Hello, my name is Michael Gatzoulis, and I'm a consultant cardiologist with interest and expertise in congenital heart disease. Um, this is an initiative, we call it Adult Congenital Heart Disease Forum, that is intended towards patients with congenital heart disease around the world, and also physicians and healthcare workers related to their care. In these unsettling times with the pandemic of COVID-19, there is understandable a lot of anxiety amongst patients and lack of specific information concerning patients with congenital heart disease. And this is the driver behind this. In the first instance, I would like to say that the majority of adults with congenital heart disease are relatively low-risk subjects, even if they were exposed to the virus and had the disease. That being said, it is entirely appropriate and paramount that all patients with congenital heart disease respect the social distancing principle, because that means that A, they protect themselves from being infected, and B, and perhaps more important, they contribute to delaying the spreading of the disease. So then healthcare systems prepare and able to cope with the load. It is an aggressive virus. The transmission is through close contact and the air droplets. It takes some time for the symptoms to develop, so patients may be carriers or infected without exhibiting symptoms. The majority of patients have a flu-like illness, some of them very mild. The symptoms that we must recognize are new onset chronic cough, fever, and also painful tongue or loss of taste. The treatment that we have at present is supportive. So for the majority of patients having painkillers and having fluids, for a minority of patients, they may require hospitalization, and a proportion of them intensive care support with ventilation. I think it is important to communicate that the risk to the majority of patients is relatively low. An additional advantage for ACHD patients is they're relatively younger, and we know that older age is a risk factor for outcomes with this disease. It is also important during this period of self-isolation, which is going to take some time, that patients remain physically active and perhaps an opportunity to take better care of themselves. Another risk factor for outcome from this pandemic is diabetes and systemic hypertension and obesity. So there is an opportunity for us to improve our diet, optimize our weight, and I repeat myself here, remain physically physically active. Through this unprecedented pandemic, we are seeing a lot of change, including the use of technology for interacting and supporting our patients. There is also opportunity through technology to keep in contact with family and friends and patient associations through this difficult time. I appreciate the opportunity to talk to you. Thank you to Live Media who facilitated this. And I intend to come back either myself or with colleagues from around the world with further information, which I hope is of value to you through these difficult times.